All right, hello there. It's Monday, December the 14th, time for our daily briefing with Dr. Sanders on KLAM and KCDV, and you folks joining us on the YouTube channel, youtube.com/Cordova TV. I'm J.R. Lewis, glad to be hosting with you. We've had some growth on the dashboard, and we will have that put into perspective by the doctor, as well as the main topic of the day. The big news really worldwide, certainly in the nation, and that's the first rollouts of the vaccine, and when Cordova might possibly see some of that, and what the plan is once it arrives. We come to you in the 1, 5, and 8 p.m. hours on the radio. We get uploaded to youtube.com/Cordova TV as soon as possible, and are pleased to be able to bring you today's report for the 14th. All right, Doctor, couple of interesting areas to cover. First off, our dashboard. We had a few more cases appear over the weekend. What is okay to say about that?
Yeah, we have a small number of cases that are all related. We've kind of been standing by watching closely after Thanksgiving to see if we were going to have small clusters pop up. And really, everything has stayed very contained. I feel like the community continues to stay in a good position with regard to the larger COVID outbreak that's going on throughout Alaska. So
good. All right. So it's not spreading randomly around the community is kind of the good aspect of that. Although it's obviously never good when we see cases, but it still seems to be, again, as most of our little outbreaks have been, confined within a certain cell, I guess.
Yeah, absolutely. They are confined. We're still in that high alert zone because the hospitals and the hospital staffing issues are very fragile throughout Alaska right now. And so we will continue to ask everybody to exercise that extra caution. But for the most part, Cordova is doing very well. Good.
Well, let's move on to the big news all across the country, certainly, I suppose, around the world to some extent. And that's the beginning of vaccine distribution. So evidently the emergency authorization happened over the weekend?
Yes, it did. So really just like everyone in the country, doctors and I myself have been standing by and tracking the safety data. We're watching. This is a new platform with the mRNA vaccines that have not been rolled out in such a large scale ever. And so we're certainly paying attention, but very excited that we do have this new platform to be able to use and hopefully curb the spread of COVID. Here in Cordova, we will be following the CDC's guidance, which is to start immunizations with their healthcare workers, first responders, and long-term care. And once we get through those groups, then we will see what vaccine we have available and start a community initiative to get those vaccines hopefully sometime early this spring. We're getting our first small shipment of vaccine for the healthcare workers and first responders this week.
Okay, and I guess it's a little early to tell, like when a next shipment might arrive, and a next shipment might arrive. It's going to really sort of depend on the national need.
Part of it is national and state, and part of it is our own local capacity to get them out. So we're working on organizing so that as soon as they're available, we are ready to have a pod to deliver vaccine to the community. Okay.
Well, I mean, is it I get an opportunity to review test data and things that, maybe the general public doesn't see as often. Is it a little early to ask, are you fairly optimistic about this, or do we really still need to kind of wait and see?
At this point, the data that has been released hasn't been a huge significant amount of data, but I have been watching, and I certainly look and watch the science maybe from a different scope than other people do. At this point, we do have, with the trials, we had 70,000 people that were vaccinated just in the initial trials with no serious adverse events or deaths. And that's a really significant thing that we got through those trials with that large of a number. Part of the thing that has made this go so quickly is at the same time they were doing the trials, which were run exactly how we would run a normal vaccine trial, they were also producing the vaccination. So that is the unprecedented part. We were producing it at the same time, recognizing that it might be not, the vaccine might be produced and then never used. So they took that risk and they produced it. And now, as soon as the trials are done, they also have vaccine available for distribution. So that is a really pretty amazing approach that they took. And that's what has enabled us to move relatively quickly. I have heard a lot of people say, oh, this is happening so quickly. You know, if you look on the CDC's website for the H1N1 flu pandemic in 2009, it was April that they first identified the novel H1N1 flu strain, and they had vaccine by December for people. So sometimes this does feel fast. I think that we're really focusing on the speed of this, but it's actually really following the pretty standard process for developing something. What's new is that this is an mRNA vaccine. mRNA vaccines have been in development for over 20 years. They haven't been deployed as large as we're going to do with this over the next few months, but it is not a brand new technology. These have been being evaluated and closely studied and even used in human trials for some time now.
Okay. And what about the planning for the rollout that has accompanied the production? Is that a fairly new? I mean, because people were saying, okay, as soon as we get this vaccine, we want to get it to where it needs to go as soon as possible. Is the rollout planning a sort of a new or unprecedented thing, or is that something that's also happened frequently in the past?
No, we always do this rollout planning. Now, when the rollout planning started 2 or 3 months ago, a lot of us felt like, oh, this might be premature. Are they really going to have this ready? But we were going through the paces of planning, and we've been doing that planning for the last couple months because we were being told we needed to be ready. And sure enough, here we are. We've been planning for some time now, and we're putting those plans into action.
Good. Well, I mean, it sounds like it's moving in the right direction. As far as life in Cordova, have there been any recent, what you might call a frequently asked question that you run into, or some scenario you see recur a lot where it might be good for a number of folks to hear the answer to the question?
We always get some questions regarding travel, and really the state has an excellent travel site. We do ask that people, after you travel, that you get tested, whether it's the 72 hours prior to travel or at the end of that 7-day period once you're in Cordova. We do want people to get that second test after that 7-day period and social distance, or as the state calls it, strict social distance for 14 days after arrival. So that continues to be, with the holiday travel, kind of our biggest risk zone of where people are contracting COVID and then bringing it back to the community. And otherwise, no, just everybody have a safe winter and enjoy the snow.
Yeah. Well, and the city is going as far in its news releases as to saying that elective travel is discouraged. It's certainly not banned, but it's not recommended because it's an obvious a potential way for the virus to sneak into the town and start moving around. But even again, these times where that has happened, you got to be happy with how folks have done keeping it contained. If it's in their household or in their bubble or just barely expanded bubble, they seem to be locking it down pretty well, huh?
Absolutely. The travel is our biggest risk for Cordova, but they do seem to be locking it down well. One thing that I'll mention is, since I brought up winter and the snow, the hospital staff has done an excellent job trying to decorate the backside of the hospital to help brighten the winter for our long-term care residents who have been pretty isolated throughout the pandemic. And it's also a challenge because they are not able to have visitors and some of the same things that help brighten the holidays. We're hoping to get Cordovans to go and enjoy the area behind the hospital that has lights and wood-decorated snowmen, so that they can have the long-term care residents come to the windows and be able to wave and see people playing in the back. Hopefully people can enjoy walking through, bring a cup of hot chocolate, and enjoy a nice evening walk with the lights and the snowmen. Or during the day when there's snow, we have a snowman building competition that we're encouraging the community to participate in so that they can give an extra wave and some cheer to our long-term care residents.
Great. Well, I hope we'll get a chance to learn more about that and maybe help promote it a little bit. And in the meantime, thank you as always for your time. We enjoy the chance to visit with you.
Thank you.
All right, our thanks again to Dr. Sanders for joining us on the daily briefing here, 1 p.m., 5 p.m., and 8 p.m. hours on the radio. Although those may move around a little bit with some of the special holiday programming that's starting now. We also upload to youtube.com/Cordova TV as soon as possible. Dr. Sanders has been great about spending time with us here, and we want to offer thanks not only to her, really, but all of the hardworking medical folks who are dealing with a challenge they probably didn't know they would be dealing with, but are rising to it nonetheless. And we will eagerly join you next time here on KLAM and KCDV. Back now to regular programming.